Hi there. Thank you for tuning in and for sending your questions. I'm Dr. Clelia Lima, nurse practitioner with a passion for wellness. Our topic today will help you understand your snoring and to get rid of it, how to do that. Also, its implication on your health. I will also give you an update on the COVID 19. So, ready to get rid of your annoying snoring? If you snore, your bad partner may be annoyed and they may complain. So you may get annoyed. But is snoring just an annoyance? And how to get rid of it? So, snores can be classified in several ways: mild, moderate, severe, soft, light, loud, heroic, epic. You see all kinds of names. I'm going to give you some examples in a classification in decibels, okay? So to start, let me tell you that a normal breathing is only 10 decibels, barely audible, okay? So mild snoring, 40 to 50 decibels. Just to have an idea what it means, 40 decibels are like a quiet library sound, okay? We go to the library, it's kind of quiet, that kind of sound. Moderate snoring, 50 to 60 decibels. And 50 decibels are like a moderate, rainfall. You're sleeping, the rain is falling outside. It's kind of, it's okay. Severe snoring is over 60 decibels. And 60 decibels are like a dishwasher. It's a big noise. Most dishwashers are really annoying, right? So keep in mind that some people with severe snore reach 70 decibels, like a vacuum cleaner, or even 90 decibels, like a lawnmower. Yeah, can you imagine? It's possible that some severe snorer may go higher than 100 decibels, like a jet taking off. Can you imagine? No wonder the bad partner is so annoyed. It's kind of disturbing, right? But just for you to, to put into perspective, over 85 decibels for extended time can cause permanent hearing loss. So it's not only an annoyance, it can be really detrimental to your health, right? So somebody just asked me, what is snore? What is it? So when you sleep, your upper airways, the muscles, especially the tongue and the soft palate, those tissues relax, which is normal. We all go to sleep and those muscles relax for the sleep. But for some people, this relaxation is excessive. So it causes the narrowed or causing a partial obstruction of the soft tissues. So make it narrow and then it kind of, a partial obstruction. So when you breathe in and out, the airflow, through this narrow pathway and the tissues vibrate, causing the snoring sound. So basically, it's the vibration, on the soft tissues. And then somebody asked, and how common is snoring? Actually, people of all ages, including children, all genders, in all places all over the planet, they may snore. So some statistics show that half of the adults in the United States snore at least occasionally. About 57% are men and 40% of women, they snore. And up to 27% of children are snorers too. However, the severity and the health implications of snoring, it varies, And then comes the question, how to get rid of your snoring? how to get rid of it because it's so annoying and so disturbing. So the answer to that question will depend on what's causing it. I'm going to give you 10 high risk factors for snoring, and then I'm going to tell you what to do about it, okay? So, risk number one, I think you can guess that one, obesity. Yes. If you are obese, the diameter of your upper airways is smaller because you have the fat tissues outside, but it's fat tissue inside as well. So your soft tissues are more crowded, because of the fat tissues around your neck. So that increased the resistance of the airflow, and that causes snoring. Okay, so how to resolve that? Yes, you may have guessed too. Lifestyle modification, weight loss, but not only losing the weight, but keeping the weight off, right? So it's interesting that even small amounts of weight loss may decrease your snoring. So get to it. Risk number two, allergies and upper respiratory infections. If you have allergies or you have an acute upper respiratory infection, you may have swelling of your upper airways. So the soft tissues get swollen too, and then narrow the passage and you snore. So, what to do about it? You can use over the counter nasal sprays, humidifier in your room. Those things can help you, clean up your upper airways and make sure that your soft tissues are not swollen. Sometimes you need, prescription medication. Then you have to talk to your doctor about it. Okay. So the other thing for that, the same risk is to maintain your immune system well supported, strong, so you don't get as many infections. And drinking lots of water. Hydration, hydration, hydration is good for so many things, including infection of your upper airways, and then helps with your snoring too. Risk number three, medications. If you take sedatives, sleeping pills, even some antihistamine, it may cause the relaxation of your upper airways and being narrow, increase the chance that you snore as well. So it's interesting that antihistamine may work both ways. It could be a cause of snoring because it relaxes your upper airways. It could be um, a, a solution to your snore because the antihistamine may help to shrink the swelling of your upper airways. So talk to your doctor. You may have to change medications or dosages. You have to see your particular situation. And as far as taking sedatives and those, you may consider other options with your doctor or even weaning off. Okay, so talk to your doctor about that one. Risk number four, anatomy. You were just born like that. Some people have deviated septum, and that's just the way they are. So for that, it's recommended if it's really, bothering your breathing and causing you to snore so badly that it's disturbing your sleep, you may get a referral to see a ENT and consider possible surgery. Also, some people have a narrow maxillary, and that could also, be a detriment to your breathing as well. The other one is some large neck, and that has, it's just the anatomy, the way the person acts. In some people, they're just born with enlarged tongues and tonsils, So if you have that too big, that would be a way to obstruct your upper airways as well. And there is a classification called the Mallampati classification that is very interesting. You can look in the mirror and see how your upper airways are open or not. Because if you open your mouth really big and you don't see your uvula, you don't see your tonsils, if you have them, and it's all crowded out there, that would be a sign that you may get some obstruction there as well. So discuss with your doctor about that one. Risk number 5, alcohol. If you drink alcohol close to the bedtime, that can relax your throat muscles and your soft tissues as well and cause you to snore. So avoid drinking alcohol, or if you drink, drink in moderation and at least 4 hours before your bedtime. So it can be out of your system when you fall asleep. And by the way, if you drink too much and you need help to stop drinking, talk to your doctor, because you may get referral for treatments and medication that can help you to stop drinking if that's a problem for you. Risk number 6, smoking. If you smoke, your soft tissues in your airways get irritated and it can produce excess mucus and constriction, causing snoring. So, what is the solution? Stop smoking. And it's not only for snoring, stop smoking is for so many other health benefits and financial benefits too, right? So discuss with your healthcare provider. There are medications to help you stop smoking. Also, programs out there that are, very effective to help you stop smoking. So don't don't delay. Get that done. Risk number 7, sleep deprivation. If you are sleeping less than 6 hours per night on a regular basis, you may be sleep deprived. And the sleep deprivation causes your upper airways to relax too much, causing snoring. So give yourself the opportunity to sleep at least 7 hours per night. If you have a problem with insomnia, talk to your healthcare provider. Cognitive behavioral therapy for insomnia is very effective, actually better than medication. And we have several talks about that. So sleep is my specialty, and you can go on my YouTube channel and find several videos about sleep, and that can get you some help. Risk number 8, sleep position. If you sleep on your back, it can decrease the airflow as your tongue, and jaw relax, causing snoring. So sleeping on your back, you promoting that obstruction. So change sleep position is the solution. Try to sleep on your side. There are products in the market that help you to prop um, your body in a way that you don't roll over again to your back. The wedge pillow is one of my favorites because it props you in a very anatomical way. I don't know if you have heard of people that they sew a tennis ball on a pocket of a t-shirt and put on the back. I really don't recommend that, because usually when you turn trying to go turn in your back, it wakes you up to get you back on the position on your side, and waking you up, it will disrupt your sleep. So I don't actually like that very much. By the wedge pillow, there are several kinds of pillows in the market. So look for the one that you feel more attracted to and may be good. Risk number 9, mouth breathing. If you are a mouth breather, you actually bypass your nasal mucosa. So when you breathe, you don't get the benefit of the nasal mucosa, and then that will be a regular breathing, and that causes snoring too. Actually, people that are mouth breathers, they have several complaints about dry mouth, and the throat is actually so irritated because it's so dry. So what is the solution? Try to breathe through your nose during the day, because some people don't realize, but they may be breathing through their mouth when they're awake as well. That will retrain your body to go ahead and say, oh, that's the right thing to do. Some people like the nasal strips that helps to prop your, nose to open up, and helps like a dilator to promote you to breathe through your nose. A mouth guard may help you too, because a mouth guard helps to keep your mouth, closed. So then, but most of all, talk to your healthcare provider while you're breathing through your nose. It might be other conditions, including the anatomical things that we just spoke about, and you might have other options how to correct that one. And number 10, the risk number 10 is old age. And then somebody told me, that's nothing I can do about that. Then actually the old age decrease your muscle tones. Actually decrease the muscle tones all over, but in your upper airways too, the soft palate and in your throat as well. But there is hope. Um, there are exercise for your tongue and for your mouth that helps you to strengthen your upper airways, the soft tissues and the muscles that support your upper airways. So it's called the myofunctional program. It's a physical therapy actually, and it's good for any age, even for children. You have different exercise with your tongue, with your mouth, with your face, and that helps to strengthen the muscles, and you can get some benefit and help with your snoring too. So that's a very interesting thing that they can look up and take advantage. So you got 10 reasons, 10 risks, and what to do about them. But then somebody asked me, should I be worried about my snoring? And the answer for that one is, if your snore is chronic and you've done all these things that we're talking about, understand risks, and you're already doing that, and it's not helping your snoring, especially if you are obese or if you have other health issues, it's time to talk to your doctor. You may be a high risk for obstructive sleep apnea. So for our discussion today, we're just gonna call it sleep apnea because there are several classifications, and we're not gonna get into that. Actually, that would be a talk all by itself. But I'm gonna give you a few pointers on the sleep apnea. So we've been talking about the upper airway muscles and the soft tissues being relaxed when you sleep, and then the snoring. The sleep apnea, the same anatomy, the same process happens, but then it's more severe because it's not only narrow, it actually obstruct and prevent you from breathing. So intermittently throughout the night, you stop breathing because your soft tissues are collapsing and obstructing the passage of the air. Then you can have, already, very smart. You can say, okay, so if I stop breathing, what happened with my oxygen? It goes down. So that increase your risk of cardiovascular disease, strokes, very serious, high blood pressure. It goes, all together. So people that snore are very high risk for sleep apnea, especially if you snore very loud. And some people, they can actually have the bad partner to tell, yeah, you snore very loud and you gasp for air, so that means that you will stop breathing. So 90 to 90% of patients with sleep apnea, they snore, so pay attention to that. Very important to have an assessment to see your symptoms in order to see if you have sleep apnea. The way to actually make a diagnosis is doing a sleep test. So the sleep study can be done overnight in a sleep lab, or it can be done at home with the home sleep test, I mean, a home sleep device. So it's your choice, and the choice with your doctor to figure out which one is more appropriate for you. So the choices of treatment depends on the severity of your sleep apnea. Just to have an idea, mild sleep apnea is when you stop breathing 5 to 10 times per hour. That's mild. Moderate, 15 to 30, 16 to 30 times per hour. And severe, over 30 times stop breathing per hour. So that's very scary, because I have had patients that stop breathing more than 100 times per hour, and oxygenation level going so low that, naturally they had other health issues related, because that was going on for some time. So other symptoms that you want to look for during the day is that if you feel tired in the morning when you wake up, it's like you're not refreshed. During the day, you feel sleepy. You have a lack of concentration. You cannot focus on your work. If you're tired all the time, just make sure that you get an assessment, because you might be dealing with sleep apnea and you don't know. So the types of treatment depends on the severity of your sleep apnea. And losing weight is the number one. And actually, some people losing weight, they resolve sleep apnea completely or get better. But don't be fooled, because some skinny people have sleep apnea too. And I have had several patients. They were not obese and they had sleep apnea. So weight loss is the number one benefit. The gold standard treatment for sleep apnea is the CPAP. You may have heard of the continuous positive airway pressure. So several kinds of CPAP, BiPAP, AutoPAP, and we're not going to get into this today. And then you have number of different kinds of masks, different masks that you can change, and you can see the one that you adjust the best. So this is the gold standard, but some people cannot tolerate a CPAP. So other options is the mouth the mouth appliance that is done by a dentist and is completely personalized for you. Other options are it's kind of interesting. Surgery for sleep apnea. And I have had several patients that did the surgery and they came back because it didn't resolve completely. But it's a very traumatic surgery that takes part of your soft tissues, the back of your throat and amygdalas, and sometimes part of your tongue. But it is a treatment, and some people do well. Another one that is more recent, a few years, is the stimulator device that is implanted, in your upper chest, and then it kind of connects with your hypoglossal nerve, which commands your tongue. So in your breathing, when you stop breathing, it stimulates to breathe, so you don't need to use a machine. But not everybody's a candidate, just so those are options out there. So, as you may know, I am a sleep specialist, and if you need any help, I'll be happy to have a consultation for you. And today, I'm offering you a free consultation to assess your sleep apnea risk. So you just have to mention this talk, and I'll get you a free consultation for to determine your risk of sleep apnea. Okay. So just a little update on the pandemic. We're still, on alert, even though our numbers in the U.S. and many countries are going down. We have seen China and United Kingdom numbers going very high. So we kind of, being very respectful to pay attention, actually to make sure that we continue good measures, continue to make your immune system well supported, strong, and wash your hands. If you are in a place that is a higher incident, wear your mask. So just be a good steward of your habits and the way you trying to minimize your exposure. So we still have the oral treatment with Monopurvi and Paxlovid, and we're just doing the best we can and connecting with the people we love, because it's very important to keep our good connections, because that's part of strengthening our immune system too. So please subscribe to my YouTube channel, like my videos, and share with your friends. And see you next Tuesday for another Q&A. Keep moving towards your best self. Be healthy and feel well.